Wonderful. And it is 4:05, so we'll go ahead and get started. And with that, I'm going to turn it over to Heather Castleton.
Hi, everyone. My name's Heather Castleton. I'm zooming in from Victoria, British Columbia. I'm one of the directors for the new North American Hub. And I just wanted to begin our time together with a land acknowledgement. And if you're not familiar with whose land you're on, there is a map here on the slide deck that shows where we are situated in the North American hub for Canada and US. And just a reminder that Mexico has joined with the Latin American hub for the shared language. For those of you who don't know what a land acknowledgement is, it's typically to recognize the land that is the traditional territory of the Indigenous peoples whose historical relationship to that land continues today. And I just want to point out something that Nicole Redvers, who is a global scholar in Indigenous planetary health, has written extensively about that planetary health as a new field is primarily a Western construct, as Indigenous knowledge systems have never had any separation between the health of the planet and the health of the self or that of communities and ecosystems. This means that applications for planetary health are directly rooted in Indigenous community values and based on protocols for living in harmony with all. So, with that, I encourage you to think about whose land you're on and who the Indigenous peoples you might learn from about Indigenous approaches to planetary health by reaching out. I also encourage you to just take a moment to look outside your window and see whose land you're on and how you can play a role in stewarding and caring for that little patch that's outside your window. And to also think about these things on a larger scale in the work that you do. For myself, I'm zooming in from Lekwungen and Wasanich territories. This is on the southern tip of Vancouver Island in British Columbia, Canada. Thanks so much, and I will pass it back to you, Joe.
Thanks. I lost my mouse for a second. Great. And I'm going to turn it back over to Kent Boyd, who's going to talk about the meeting purpose and agenda.
Thanks, Joe. Thanks, Heather, for that introduction into land acknowledgement. I'm Kent Boyd. I am a doctor of nursing practice, registered nurse, um, coming to you all from Minnesota, the St. Paul area. Today, we're going to touch base with you all about what we discussed in our inaugural meeting as a council earlier in August in Victoria. And thank you to our lovely host, Heather, for bringing us all together. But then also, what we really want is to hear from you all. The hub is more or less starting from ground zero. I know there's been a lot of work from the North America region in planetary health, so we want to get a feel for what you all are doing and how we can help you to be successful in this work. So that's kind of what we're looking at for today. We'll start with introducing ourselves in the next couple sections. Heather will give an update to what we discussed as a council. Uh, Hannah from the Planetary Health Alliance will give a breakdown of some early survey results as we were developing this council and what it may look like for those that responded to that. And then we'll go into breakout groups where we focus on five different potential working groups that the hub could provide for you all and understanding your capacities and again, how we can best serve you. And then if there's time afterwards, we'll stick around for some questions or comments. But otherwise, this is really just to get to know you. This is one of many future meetings with all of you. And with that, I'll pass it on to Heather because she's the first council member to introduce herself.
Hi, everybody. It's me again, Heather Castleton. It's just a real thrill to be here with all of you today. I'm the co-strategic director, Canada side, along with Kent, who's my collaborator with co-strategy. And I'm a professor and impact chair in transformative governance of planetary health at the University of Victoria. I'm a former Canada Research Chair in Reconciling Relations for Healthy Lands and Communities. I'm a podcast co-host for Indigenous Planetary Health that I hope you'll check out. And some of the pictures that you see reflect the kind of work that I do. I do a lot of work in solidarity with Indigenous peoples on environment and health issues that are priorities to them across so-called Canada. And I would identify as a health geographer. And yeah, just really thrilled to be here. I've got some experience in along the lines of decolonizing research and institutional practices. And so part of my role as an impact chair at my university is to contribute to the decolonizing of this concept of planetary health to really reflect and embrace and elevate Indigenous ways of being that really can show pathways towards planetary health and healing. So, real pleasure to be here, and I'll pass it over to our next director.
And that's me. And then I promise after this, you won't have to hear from Heather or I for a while. So again, Kent Boyd, the U.S. Strategic Director. So Heather's collaborator south of the border. And yeah, like I said, I'm a doctor of nursing practice, registered nurse. I had the fortune of studying, uh, or my faculty advisor was Dr. Teddy Potter, and she has connections throughout Planetary Health, but also throughout this council, as you'll come to see. A lovely person, a great leader, and thankful for that. Um, I come at this role with that mindset that nurses play a very critical role in this work in planetary health as holistic viewers of the world of health, and kind of those connectors and collaborators in that sense. And that's what I aim to do here as a co-strategic director. I currently work at the University of Minnesota in the Climate Adaptation Partnership, so helping communities across Minnesota, the Midwest, and also nationally to prepare for and adapt to our changing climate. Less on the mitigation side, although we do look for those co-strategic or co-benefits and strategies there. And more importantly, I am a husband, I am a dog dad, I love to travel. I started my nursing career in pediatrics. I love kiddos. Um, yeah, and that's a little bit about me.
Great. Hi, everyone. My name is Jo Bjorgard. I am a registered nurse and also a doctorate of nursing practice. Also a previous student of Teddy Potter's, who is a, very important mentor and advisor to many of us. I am originally from Victoria, British Columbia. I currently reside in St. Paul, Minnesota. Um, and I hold a few different roles, amongst being the operations director of the North American Hub. I'm also the senior climate and health manager at an organization called Climate Advocacy Lab. I'm the founder of Rise Climate and Health Collective, and I also teach at the University of Minnesota. I have four kids between the ages of 14 months and 13 years old. So we have a bit of a chaotic home with lots of kids, a couple of ducks and several chickens, big garden with lots of bees and butterflies. And that pretty much sums me up. I am going to pass it on to Stefan.
Hi, everyone. So nice to be here with all of you and get to see some lovely familiar faces and new faces. And I'm so grateful to be here with this council. As Joe mentioned, my name is Stefan Wheat. I am the co-education director alongside Ashley, who you'll get to meet here momentarily for the North American Regional Hub. I hail from the University of Washington in Seattle, Washington, on the unceded lands of the Coast Salish peoples. And my primary roles are in education around planetary health and climate change and how that intersects with the health, with human health. I hold roles with the University of Washington as well as with the Global Consortium on Climate and Health Education out of Columbia University. And I'm very excited to be here and get to hear from you and learn from you about what you would like to hear and how we can learn from you and how we can collaborate with you to educate folks around this issue. Um, these are some of my favorite pictures from some recent adventures between my wife and I, and it's very nice to meet and connect with everyone. I'll pass it on.
And that's me. Hi, everyone. My name is Ashley Imone. I'm the co-education director along with Stefan. Education strategy. I don't know what I was thinking, but so honored to be in this position on the inaugural council of this hub, and very much looking forward to learning more about how we can sort of advance and expand planetary health education. My own background is in nutrition and public health. I have a position at the University of Toronto in the Dalla Lana School of Public Health, and that's where I'm zooming in from right now. And for myself, I love Northern Ontario. For those of you who know Northern Ontario, some photos depict that here. I also have half of my life in Kenya with two small kids, and just very motivated by the sort of connection to land that Kenyans have. And so I hope to also bring that to my planetary health education endeavors here in Canada as well. So very nice to see you all and meet you all. Thank you so much for joining, and look forward to connecting with you further. Thank you.
Hi, I'm Megan Miller. I'm the communications director for the club, and it's great to see so many faces and to see you all here. And thanks for spending some time with us today. And I'm really excited to hear why everyone's interested in what they can bring to the hub and where we can go with this. My background is in public health, so I have a master's in public health, and my most recent role was running the health portfolio for a media development organization. And I worked a lot with journalists around public health issues, including planetary health, and looking at planetary health from a journalist angle or from a health information angle. So very interested in this topic area and coming from the health and kind of information and health information journalism angle. And really excited to be part of this and work with my fellow directors and to learn from all of you. So I'm from Boston. You'll see very clearly. I'm obsessed with public health. Done a lot of work on mis and disinformation. I have two beautiful cats. I have two beautiful kids, and love to travel. So I'm excited to be here. Thanks.
Hi there, everyone. My name is Angelica Walton. I am very grateful to be here with all of you, like my colleagues, and get to know you. I am a nurse, I'm an educator, planetary health leader. I teach at the University of Minnesota School of Nursing, and our interprofessional programs as well about global health systems and nature's rights and environmental justice. And the scholarship work that I focus on and do with many different teams and communities really bridges holistic practice, the arts, healing justice frameworks, into how we kind of transform how we learn and lead and how we design our health systems to be rooted in Indigenous knowledge and really place-based wisdom. And as the new director of research and scholarship, I am most excited to help streamline how our networks are collaborating so that we can kind of work more cohesively together and share resources and really truly take that collaborative stewardship approach, if you will, to this work that we all care very deeply about. I have four animals. I'm from New Orleans, Louisiana. I love to travel. I've actually spent 8 weeks living in one of those rooftop car tents a year ago now. or maybe it's more than that. But it was during the pandemic. I worked on the front line as a COVID ICU crisis response nurse, and that was my way of reconnecting so that I can continue like being available and present to do that work. And so these are just some pictures from some of those beautiful places, and that's where I started to get really inspired around this eco-social restoration concept and what it means to kind of create learning opportunities or connection-based opportunities where we're remembering those relationships and remembering has a significant influence on, I think, our sense of agency and engagement with climate action. So that's what I'm focused on in all sorts of creative different ways. And that's enough about me. I'm going to pass it on to my colleague. I think it might be Mark. Yeah.
There we go. Turn the microphone on. Hi, everybody. It's great to see so many people here. My name is Mark Terry, and I'm the Policy and Advocacy Director for the North America Regional Hub of the Planetary Health Alliance. I'm also a professor in the Communications Department at York University in Toronto, and that's where I'm based. And I'm also the Executive Director of the UNFCCC's Youth Climate Report. That's a digital database of short documentary films made by the global community of youth. And I'm also the director of a research project called the Planetary Health Film Lab. And the idea of that particular project is to help amplify the voices of people living in remote parts of the world, in particular Indigenous communities, to tell their stories of climate impacts to the United Nations. So we travel around the world, we visit these communities, and we train them how to use digital media, and then we let them tell their stories. And then we bring the stories to the COP conferences every year. So it's a very exciting project that I'm involved with. And you see some of the pictures down there. There I am, the first one, sitting at a press conference at one of the or one of the COP conferences. The middle picture is me in Costa Rica with some students. The bottom one is at the Torngat Mountains. Not a lot of people know where they are. They're on the east coast of Canada, and they're quite majestic. They don't get enough press. And this is me in Ghana with some other filmmakers. And finally, it's my cover shot for Eden Magazine. And I look forward to working with everybody here and hearing from all the other members of the hub later on. Thank you.
Hi everyone, my name is Aman. I'm actually finishing up my undergraduate degree in geology at Western University, which is located in London, Ontario. I was involved with the Planetary Health Alliance through their Campus Ambassador program, and now I'm super happy to serve as a co-youth director alongside Yvonne within the North American Regional Hub. I'm particularly very interested in the many ways the Earth systems interact with human health. I'm also very passionate about environmental justice. And most importantly, I'm interested in how to involve youth into these spaces. I'm really looking forward to working with you all, and I'm really happy to be here.
Hi, everybody. It's nice to see you all. My name is Yvonne Mangari, and alongside Aman, I'm the other youth director from the United States. I'm currently a nursing student at the University of Minnesota. I'm in my fourth year, getting my BSN soon next year. Um, I've gotten involved in planetary health more so starting in high school. There's an organization called Climate Generation that I was involved with. It kind of helped me learn how to lobby, how to give presentations to other youth within my community, and I was able to testify for bills like the Youth Climate Justice Education Bill and the 100% Clean Energy Bill. And I was able to attend like conferences such as COP. So it's been a wonderful opportunity learning more about planetary health within my high school and kind of transitioning to college. I've become more passionate about trying to get more students, especially nursing students and those that are within healthcare, to learn more about planetary health and how they can be stewards within their own communities to create change and to inspire others around them and to understand that planetary health is something that affects all of us and it can come in many different varieties, whether you're not in healthcare or you're not really in climate type of work, you can definitely be involved in such changes. So yeah. Other than that, I'm studying abroad. I'm in Ireland, Limerick, Ireland, so it's like 10 p.m. right now, kind of late, but I'm really happy to have joined you guys. Um, I included some pictures of this one nursing conference that I attended earlier this year, a picture of Ireland and Canada, and then a picture of my siblings. So I love spending time with my family and then traveling a bunch. So yeah, that's me.
All right. Thank you so much for the introductions. I'm going to pass it over to Heather Castleton to do council updates.
Sure, thanks, Joe. And I wish we had time to go around with all 74 of us who are on the Zoom call right now, but we are going to have some breakout sessions shortly. We just wanted to give you a sense of what's been happening as we've ramped up to this meeting today. As you may have known through the Planetary Health Alliance, Hannah Turley organized a couple of open calls and a survey that you're going to hear about shortly around trying to generate interest in establishing a hub. And so that work unfolded over the fall of last year. And her and I and a group got together and started to develop a terms of reference in draft form over the spring period that would allow us to then put out an open call to anybody who had expressed interest to Hannah over the last several years around being involved in a North American hub. Once that call went out, we had all of these fine individuals come forward and say, yes, I'm willing to volunteer my time for the inaugural council. So it's just a real delight to be able to work with such outstanding folks. And it was really important for us to have youth perspectives on the council. And so everybody else has a singular role, but we wanted to double up with youth, and we're so glad that Yvonne and Aman are part of it. In order to get us kicked off, I was able to use some of my Impact Share resources to bring us all together to have that very important face-to-face conversation, relationship building, team building, getting to know each other. And so we met a month ago. It's hard to believe it's only been a month. There's a lot happened since, but we came together for a couple of days here in Victoria, BC, where we went over the terms of reference that had been developed in draft form. It's a living document, and you can see it on the PHA website under our regional hub. It's available to you there if you haven't had a chance to look at it. And it was at that point that we really wanted to engage with a sort of a strengths finder exercise to look at where did all of us come from, and where were our strengths, our values, our passions, and spend that time getting to know each other through a process that Kent led us through called social change ecosystem mapping. It was pretty cool. And you can ask Kent about it. You could drop maybe a link in the chat just to explain what that it looks like. We also had an opportunity to spend time with somebody from the Songhees Nation who was able to take us on a tour of the Victoria Downtown Harbor to understand what this place was prior to European contact, to understand how Songhees continue to steward the landscape today, and to again just to build our relationships with each other. Later in the day, we had an open event for anybody who was a local planetary health champion who could drop by and meet the new council. And again, just generate some conversation about what could be some of our potential short, medium, and long-term goals. And we spent another half day or so just digging into that, looking at, where are our strengths? What can we potentially do? Who do we have networks with? How do we bring those of you who are here with us today together? And then we got into the nitty-gritty of how are we going to operate together? We're all meeting each other, most of us, for the first time. Having said that, Joe, Angelica, and Kent, I think, are pretty well connected there at the University of Minnesota. But yeah, how are we going to operate, and then how are we going to engage with all of you as a members launch? I think the other big thing that we did was really worked through a revised definition of our mission to inspire, coalesce, connect, and convene North Americans in all of that, who that means from all sectors to take transformative action through education, business, communication, governance to advance social, environmental, climate, gender, and racial justice. I think I might even be reading the old one, so I apologize for that. It's going to be posted on the PHA website, and I get the sense that Joe's already posting it in the chat. So thank you, Joe. So that was basically what we did. We've also set up a planetary health, a North America hub, planetary health at gmail.com email address so that if you wanted to reach any of us, that's the way to do it. I just want to caution that we are all volunteers, and so we're trying to check that email daily and get responses out to people. But the other thing that we are doing is starting to populate the web page on the Planetary Health Alliance website. And we're really eager to create membership profiles to showcase all of your work as a way of creating connectivity between all of us. But that's about as far as we're at right now. We're really very much an open book about trying to figure out how do we best serve the needs of the hub. And maybe on that front, I'll just pass it over to Hannah to very quickly speak about the other hubs in the Planetary Health Alliance's sphere of influence, if you will. We've had a chance to meet with a couple of those hubs, the hub in Japan as well as the East Africa hub. They're both doing very different things, but we got a lot of inspiration from what they were doing. The East Africa hub is very much ahead of the curve with all of its activities, especially engaging youth as campus ambassadors and other forms of ambassadorship around planetary health. And I thought I would just put a nod to what Japan's doing. They have a cafe and bar meeting once a month online, and I thought that meant was like you bring coffee or beer. It's not quite that, but it could be, and it could be for us. So just putting that out there. And Hannah, if you wanted to add anything else to what your experiences are with the other hubs, that would be awesome. And then we'll pass it on to the next person in our presentation order, which might actually be you.
Hi, thanks Heather for that lovely introduction. Hello everyone. For those of you who I don't know, my name is Hannah. I'm rebranding myself, so Hannah Antonucci, and I am the partnership coordinator at PHA. So I dropped a link in the chat to the regional hub program on PHA, but just a really brief overview. For those who are not aware, we have 9 regional hubs, of which this North American hub is one of the newer, well, the newest one that's been established. And what PHA's regional hub program is they're locally rooted communities of practice. So you just met this lovely council of directors. So they're the ones who are really going to be driving forward the planetary health movement in North America. I will say that there's a lot of interesting opportunities for the regional hubs to connect. We have interregional hub meetings every quarter, and there's a lot of cross-pollination that is happening. So all you people are based in North America, but if you're interested in learning a little bit more about the other regional hubs, I would highly encourage you to kind of check out our website and talk about them. And as Heather mentioned, the regional hubs do very similar things. So we've obviously have 2 youth directors here, and the East Africa hub is doing a lot of work promoting youth as well. We also have the European hub has a really strong research and policy initiative as well. So I would encourage everyone to think about that and how, even though we are all North American based, what the cross-pollination might be between the different hubs. That was my very, very brief overview. I'm happy to go into more detail if anyone is interested. Or Heather, do you want me to add any more detail right now?
I think that's great. Thanks, Hannah.
Okay, perfect. And I think the next few slides are me as well. So, as Heather mentioned, we do have a very brief survey. So this North American Hub, even though we have this new council of directors and we've officially launched this July, it has kind of been in the motion since early of 2024. So last May, between May and July of 2024, we as in PHA, sent out a survey to anyone who was involved with the PHA North American network at that time. So any North American members or anyone who had expressed interest in being involved in planning this North American regional hub. Out of that survey, we had 26 respondents, 9 Canadians and 17 Americans. And the original purpose of this survey was to help shape that terms of reference that I dropped in the chat earlier. And so you'll see a lot of the results kind of shaped and directed that terms of reference. So there's two major questions that we got out of this survey. So the first one is what people wanted to collaborate on most within the context of a regional hub. And you'll see from this results that education, policy and advocacy, and research and science were kind of the main themes and the main things that people want to collaborate on. You'll notice our directors, we have a director in education, we have a policy director, and then we have that research and scholarship piece. And so was just a really interesting theme to kind of think about what people are interested in and what people are interested in collaborating in. You'll notice that we did have one person want to collaborate in creative arts, but that we don't have a creative arts focus as much because that wasn't reflected in this initial survey results. Joe, if you can go to the next slide, please. The other thing you'll see is we asked about critical hub activities in this survey, and a big one was sharing of resources and tools and kind of building up this policy and advocacy. I will say that there was a lot of themes that came out over this survey results. So things that we're trying to fold into the hub and into this council, things such as collaboration, supporting and people across institutions, building on existing initiatives. So this big idea about the North American Hub is we don't want to reinvent the wheel. We want to continue going with things that are already going and supporting initiatives that are ongoing. And then a big one of empowering the next generation. There's also been a theme of moving past the building and focusing more on the doing. In North America, at least, planetary health is a more well-known term at this point. And so there's idea that the PHA and the North American Hub needs to move past educating what planetary health is and more into that action-oriented items. We want to really focus on cross-network solutions and moving beyond the medical fields, and then measuring progress and tracking progress was another big thing. But I would encourage, I think this survey, again, the data is not out of date per se, but it was used in many ways to shape this current terms of reference and the current council contribution. And we just wanted to briefly touch over it so that you all understood kind of where we were coming from. And I will pass it back off to Joe.
Wonderful. Thanks so much. And thanks everyone for learning with us about all of the great work that's informed the North American Regional Hub. And now we're going to turn to all of you, and we're very excited to have breakout discussions so we can learn a little bit more about how we can collaborate and move forward as this very large group together. So we will have the youth group, the research and scholarship group, the education group, policy and advocacy group, and an undeclared group. And I am going to open breakout rooms. You will self-select into a breakout room. They will be facilitated by a couple of directors from the council in each room. And we will come back all together in about 30 minutes to do a little bit of a report out and learn about the discussions that have happened amongst the different groups. Right, we have everyone rolling back in. We'll give it another few seconds. Hope everyone had an opportunity to meet someone new, maybe see some familiar faces, and had some really great discussion within your groups. We're going to, for the next 12 minutes or so, do a little bit of reporting back. We'll have 2 to 3 minutes per group to share back the top 3 action points or takeaways from each special interest group. So I think I'll just sort of call each group as we have them listed here. And if anyone wants to come off of mute and sort of share back those top 3 takeaways, that would be great. So we'll start with the youth group.
Hi y'all. So we had kind of a small group. It was only 2 people. But I think one of the most important takeaways was getting youth involved. A lot of things that like we all kind of agreed on was the most important aspect of engaging youth is creating some sort of incentive for them to firstly get in the doors, and also considering that not everybody will have the same baseline knowledge of what our climate state is, what the climate crisis is, and et cetera. So I think providing that information, bringing them an incentive and having them come to us with like an open mind and being able to talk about anything that they may need is very important. And then secondly, another aspect was considering like different age groups. So since youth is kind of defined within our aspects as 13 through 35, um, if you're dealing with someone that's, you know, maybe on the younger side or maybe in high school, our work within education or within advocacy might look a little bit different for them versus someone that's within university still, or someone that's post grad and still wants to be involved with planetary health, but they don't know what aspects or how to be, you know, specifically involved. So I think that's another important factor. Um, and then lastly, I think one of our important takeaways was how to be a collaborative community. So, again, like if you're kind of removed from university or whatever planetary health organization you might be involved with or might be keen to, considering what community organization you can involve yourself in to connect yourself to the community and then gain a better understanding of how our planet is affecting our health and vice versa, so that change can be created. And yeah, so I think those are kind of our main takeaways. And then also want to create some sort of like working group within those topics that I said, like advocacy, education, research, and such. So youth can come to us, and whatever they may need, we can help them and yeah, help them thrive basically. So those are our main things.
Wonderful. Thanks for the share out, Yvonne. So excited to see what comes out of the youth group. Next is research and scholarship.
Hey, yeah, we had a really rich discussion, and there are folks doing incredible research already and connections being woven and started. But some key topic areas that we touched on were the importance and the desire for this hub to serve as kind of a grounds for obviously connecting interprofessional collaborations and researchers with researchers. So one idea might be the development of like a accessible listserv, if you will, that allows you, all of us as members, to see the work that other researchers are doing so that we know who to reach out to related to particular needs or interest, whether it's developing policy, writing a grant, or what have you. Another big topic was about methodologies and how we not only share those methodologies and not recreate the wheel, but also how do we expand beyond conventional methodologies, and what does that look like in action and in real practice? Because we all identify the need to do a better job as a, you know, as a community of multiple disciplines with connecting with the people and disseminating information back to the people in a way that is preferred to those groups that we work with. So really participatory research. What are some strategies for doing that in a, you know, in a holistic and authentic way that has meaningful impact on the community? And lots of talk about nature solutions as well, and shared interest in research around this, as well as the softer components of what it means to be engaged in this work as a scholar, a physician, a practitioner. Whatever we're doing, it is taxing on the body and on the mind. So what are, you know, what are different strategies that people are doing across the region to kind of approach that in an honest and healthy way so that we can keep doing the work? So, and if I missed anything from our group, feel free to hop on and add your thoughts.
All right, we'll turn it over to the education group.
Great. So I was a note taker, and I unfortunately couldn't keep up with all of the fantastic sort of areas that people are working in. There's a lot going on in education. It's amazing. But I'll just maybe mention a few highlights. I think our discussion as we were leaving, we could have had like much more time. But what I was hearing, and again, others in the group, please jump in if you want to clarify anything. For one thing, how we can sort of work at this interface between education and advocacy. So, not just like imparting knowledge on learners, but also, how do we actually kind of, I like the words used, like push this envelope on climate action. Um, and another thing that I heard was how we can engage more, or how we can sort of include in the learning how to engage more with multinational corporations, thinking about governance, how we can incorporate other determinants of health, like commercial determinants of health. And then a lot of great discussion around what the added value of our efforts could be. So, not reinventing the wheel, not duplicating efforts, but how do we complement them with maybe some approaches that fall sort of like on the fringes, or sort of on the outer edges, that can influence education and curriculum. So some examples that were offered were focusing on some of the underinvested areas, like the health workforce and professional development, and maybe focusing on those areas, how that can then sort of cascade into degree programs, and influence sort of education in earlier years, but also really focusing on those who are actually working on the ground right now. And then also how to create more embodied education. So not just, again, delivering the knowledge and the sort of information, but actually how it can be more embodied, that can maybe lead more to action and advocacy. I hope that I sort of captured everything. I guess one thing that definitely came up often, and I totally agree with as well, is how we can collaborate and co-lead with our Indigenous colleagues. So that was a definite feature of our conversation as well. Thanks so much.
Thanks, Ashley. You're spot on. We need a little bit more time, and I apologize that I'm scooting us through these things, but we have limited time today. I see the chat is active, so keep discussing there if you want. Next is policy and advocacy.
Okay, thank you, Joe. And I'm sensitive of our time restraints, so I'll just summarize three very important areas that came up in our discussion. We had a very large group too, so there was lots of amazing contributions made by everybody in the group. But the three that kind of resonated with me was to incorporate human health into planetary health messaging. So anything that we're working on, we always need to consider how it impacts on human health, not just our physical health. Climate impacts can affect us physically, obviously, but also mental health and climate anxiety. Another section was to be, for lack of a better word, positive, and to deliver more hopeful messaging rather than focus on the gloom and doom of climate change and planetary health issues and all the horrible weather events that are related to that. To be a little more positive and talk about, when we talk about solutions that are related to this. And then the third one was that we all work together, everybody that contributed to not just the breakout group, but everybody here online today, that we take a participatory approach to a lot of the work that we are going to be doing in the future. Because many people I've noticed either are involved with a planetary health group or lead a planetary health group. So it's very important that we get that kind of feedback from our colleagues in the field. So those are the three main things for me. Megan, did you have anything to add? No?
So I think it was just really clear that there's a lot of, different groups and different organizations working, and just how interconnected a lot of issues are. And so I think the takeaway we'd like to have is to maybe have a list, or a document listing out kind of a lot of complementary areas and groups that are working on issues, so we can be complementary. We're not reinventing the wheel, and so we can really ground our work.
Thanks, Megan.
Thanks. And last, we'll hear from the undeclared group.
Hi, thanks so much, Joe. The undeclared group came up with a few things. One was a desire to create a directory of the network that we have here, and maybe even beyond that, a directory of community of practice. So all of the different things that bring us together as a group. There was a desire to have some support for the precarity of planetary health in the US at this time with the current political situation, and how can we support that work, and in what ways can the hub help to do that. Another area was around convening, how we might like to engage. There was a suggestion around having a hub and spoke kind of process, much in the same way the PHA Global Alliance has hubs. We could also create some hubs within this network so that it would allow opportunities for people who are local to each other to connect, or at a regional level. And again, thinking about limiting our climate impact. There was a desire to see a little bit of both the online as well as the in-person, face-to-face kinds of engagement. And we didn't quite get to how are we going to fund the Planetary Health North American Hub, but we're working on it. One way, for example, that I just thought I would mention real quick is that as a council, we're going to be applying to a Canadian tri-council, or a Canadian federal funding agency called SSHRC, or Social Sciences and Humanities Research Council of Canada, to have a connection grant that would allow us to have more face-to-face engagement. These are small grants, but they can also be used collaboratively to build at least some baseline funding for us to be able to operate it more effectively than just the volunteer work that we're doing so far. I think that's about all I wanted to say at the moment from our group. Thank you.
Thanks so much. All right, we had a lot to talk about today, and our goal was to get through it and be able to leave just a few minutes for questions. So I think I will first say thank you for joining us. For anyone who's not sticking around for questions, we have our email and our website here. And with that, our next open hub meeting is December 8th, 2025 at 2 p.m. Pacific time. And with our remaining 3 minutes, we'll open it up for questions, comments, and discussion.
I'm sure this will come out to everybody, but it would be great. I know the Mentimeter asked if people were going to FAM, but it wasn't there when everybody's responses, because I think they were introducing themselves and the character limit was limited. So if I'm imagining that there will be something at FAM for the North American Hub, and we'll look forward to hearing about that through the programming and other things. So I'll look forward to maybe seeing some people there, and I've got to dash off. I really appreciate everybody the efforts to start this hub in a good way. Thanks, everybody. Take care.
Thank you. Marie, you have your hand up. Go ahead.
I just want to say an amazing job. You should all feel just so good about this community coming together. It's really fantastic. So I'm just going to leave it there. Congrats.
Thank you. I'm just going to stop sharing to allow for a little bit more faces on the screen. If you don't have any questions and you want to hop off, feel free. Otherwise, the council will stick around until everyone else is gone. So we'll be here to answer questions.
Hi, this is Molly. I'm in Spokane at Gonzaga University in nursing. I just had a question. I think in a lot of the subgroups, the topic came up about Indigenous ways of knowing, and this term being a term that kind of is similar to a lot of ways people have been living for a lot of time. I was just wondering if there's like a parallel Indigenous or Native American organization, not parallel, but like another organization that would maybe be able to give some input and insight into the planetary health movement and like other perspectives on it, or like how we talked about collaborating more or including that voice in all of our work. But you know what I mean? Just like maybe if there's another way
think
to have that representation, like in this space, like a presentation or a collaboration meeting or something.
I think Hannah can speak to that. I know the PHA is trying to organize an Indigenous hub that's specifically a space for Indigenous peoples to connect. And when we put out our call for inaugural counselors to the Planetary Health Alliance hub, the North American hub, that we were really seeking to have a diverse board. And that will be a continued effort as people step off the board and new people come on to the board itself. And then I guess the other thing I would just say, I don't know if you were there when I was introducing myself earlier, Molly. There is an Indigenous Planetary Health podcast that's available for you to check out and hear Indigenous perspectives from artists, academics, and activists in this space that I encourage you to follow. Thanks.
Okay, awesome. Thank you.
Thanks. And Julianne, I see you have your hand up.
Yeah, I just kind of want to get a better sense of, so I saw we have an upcoming meeting on December 8th, but what's the kind of next step in terms of engaging? Like how do we as members, or I don't even know if we're technically signed up as members or how do we do, because I only learned about the regional hub just like a month ago. So trying to get a better sense of what that trajectory or those pathways might look like, or if that's something you're going to be figuring out from this conversation today.
Yeah, I can take that if you like, Joe. And please, everybody else from the council, feel free to step in too. What we're going to be doing is sending around a survey after this to inquire about exactly that. One of the things that we don't have is a formal membership. We don't have membership fees at the moment. We're interested in knowing if that is something that people would be willing to consider on a sliding scale of some sort. But yeah, trying to determine what our next steps are is what was the purpose of today's meeting, to get a sense of what do people want and how might we deliver, with the capacity that we have to do so. So it's still like we are a work in progress, but I'll see if anybody else has some additional thoughts from the council to share.
I think you're spot on, Heather. And please, anyone who's attending today, if you have ideas about how we can engage between now and December, please shoot us an email. We're happy to set up one-to-one meetings and discuss, and certainly want to take your desires to engage into account as we're strategizing. And Nathan, I see you have your hand up.
Yeah, thanks. Just on the question of community building or how we relate and communicate with each other, I think that is quite important, and I'm hearing that sentiment articulated. So we could have email as one. There are other social media groups like WhatsApp that is widely used, just to see how we can have interactive, inclusive framework or space for us to get to know each other. I think that would be a great way to leverage, even as we look to FAM coming up in about a month, where this topic could hopefully also feature in the meeting for the North America Hub. And then looking ahead to, I think the next meeting, December 8th, has been mentioned. So those are just some suggestions, would be to carve out space for anyone who's interested to connect and share more through that kind of networking and communication space. Thanks.
Thanks, Nathan. I know that there was talk at the council about setting up a table or a convening space at the upcoming FAM conference, but I don't know exactly how many of us are going to be attending that one, funding dependent, et cetera, et cetera. But I would say that that would be a key activity that we'll try to mobilize. We'll check in with those who are attending to see if we can make that happen so that people can have a chance to engage face to face there. Thank you. And through that, I think as well with our Mentimeter here, where we've got a sense of who's coming, we'll be able to reach out and most likely create something like a WhatsApp group for those who are going to be attending the FAM conference. Thanks.
Yeah, I'll add to that too that there are other conferences coming up between now and December and in the future related to planetary health. I know actually, Nathan, I think I last saw you at our health in DC. So we will also try to organize some gatherings during these other sort of planetary health related conferences so that if we know there are several members who are going to be attending, that we have the opportunity to get together and gather. Well, thank you again, everyone, for joining us today. It's lovely to see new faces and familiar faces. This is a very exciting and fruitful meeting. We've got lots of information that we'll take back and discuss and move forward with. So thank you very much, and we look forward to being in communication again soon.
Be well, everybody.
Take
Thank
care,
you,
everyone.
everyone.
Thank you all.